Very good afternoon, everyone. And today we are having this lunchtime talk on scholarships of teaching and learning, which is SoTL, which is the new term for us. And uh, today we have two speakers, Professor Enoka Corea from the Department of Medical Microbiology and Immunology, Faculty of Medicine, University of Colombo, and she's a renowned senior academic and also has taken up many leadership roles nationally and also with contributions to medical education, teaching and learning. And we have Dr. Vindya Perera with us today. We no need of an introduction because we all know very well. She's our she's the head of the Department of Microbiology, Faculty of Medicine, and she involves with a lot of quality assurance work and medical education related matters. So over to you, madam, to have a conversation.
Thank you very much. And first, I must thank the medical education unit of the Sabaragamuwa of Sri Lanka, and especially Dr. Vindya Perera for inviting me to this to deliver this talk on SoTL. Let me first share my slides. Please let me know if you can see my slides and hear me clearly.
Yes, madam. We can.
Okay.
We can see. It's louder.
So, as Dr. Yasas Kolumbage, thank you, Yasas, for inviting me. As he said, SoTL, or Scholarship of Teaching and Learning, is a bit of a new concept for us and a bit of an unfamiliar concept. So let me try to kind of make it more easier to understand what is meant by this term, Scholarship of Teaching and Learning, which is given the abbreviation SoTL. So all of us are academics and all of us are professionals in our field of expertise, whether we are pediatricians or microbiologists or veterinarians or whatever field we are in, we are professionals. So as part of our journey, we get qualifications in our field. So we go out, we do examinations, we do graduates, we do postgraduate degrees and other obtain qualifications in our area of expertise. We are constantly trying to broaden our horizons, learn more by CPD, that is continuous professional development, by reading journals, accessing online resources. So we may have certain join WhatsApp groups, or we may join certain groups which, for example, I join a group called ProMed, which sends me all the current infectious diseases knowledge straight to my email box every day. So keeping me up to date. So we keep up to date. That's part of our joy or passion in our own fields. We join various associations and colleges in our fields of expertise and associate and network with colleagues and peers in the field. And we also do research into our field to try and broaden the knowledge in our field. So personally, I have opted the MBBS, and I do the diploma in microbiology since that's my area of interest. MD, I did a PhD, and I joined the Sri Lanka College of Microbiologists. As I said, I am sort of plugged into the international, what's happening in international infectious diseases by subscribing to the ProMed, which tells me what's happening every day in the field of infectious diseases. So that's how we keep up to date as academics and professionals in our own fields. Right. So then what then is SoTL? How does that fit into our background? We are used to being professionals. We're used to being microbiologists. We're used to being pediatricians. We're used to being veterinarians. We know we have spent a large sort of percentage of our working lives interacting with our profession. So what then, how does SoTL come into this? The Scholarship of Teaching and Learning. So here, this is you could start by appreciating a concept called scholarly teaching. Now, other than practicing our own profession as professionals and as active, functioning, working professionals, we are also teachers. Part of our academic duties, or equally important duty as academics, is our role as teachers or facilitating learning. So scholarly teaching is where we use the knowledge or the acquired knowledge or the literature on teaching and learning to inform our own practice. So you can just be a teacher, you can just teach, you can just go and stand there and teach. But a scholarly teacher views teaching as their profession, as another aspect of their profession. So they're not just professionals in their in what they've trained as, but they're also professionals in teaching as well. And they use this knowledge base, or they appreciate the knowledge base on teaching and learning as a second discipline in addition to their regular discipline, where they need to develop an expertise. So scholarly teachers will read up on teaching and learning, will keep up to date on teaching and learning literature, will attend workshops on teaching and learning, and will also reflect on their own teaching and learning to inform and improve their own practice. So academics are scholarly teachers, so they will not only acquire um, um, expertise as professionals in their own fields, but they start acquiring expertise as teachers. So we are teachers in higher education. It really doesn't matter what level of education you're at, but you start acquiring knowledge and expertise as a teacher. So you could do that in many ways, just like you did for your own profession. You can get suitable qualifications. So I think all of us have gone through some kind of certificate of teaching in higher education, which is now a requirement for employment in the university. We may have gone to advanced and voluntary studies, such as doing the advanced certificate in teaching in higher education, or SEDA certification, or even now even foreign qualifications in education and medical education. And again, we not only do continuous professional development as your own profession, reading the journals and attending academic meetings in your own profession, but you start now reading journals and accessing online resources on teaching learning, on facilitating teaching learning. And you join associations and colleges and attend workshops to do with that. For example, there's an association in Sri Lanka called the Sri Lanka Association for Improvement of Higher Education Effectiveness. They just held their annual sessions this month. So we join and participate in the activities of these kind of associations and colleges. You may be having one in Sabaragamuwa, this medical education unit that will have workshops and conferences and networking in teachers who want to improve their ability or their expertise in teaching in higher education. So again, personally, I did the CTHE. We didn't have to do it at our stage. It was purely voluntary that I did the CTHE and obtained the SETA certification. And the university offered us free certification of free registration in the postgraduate certificate in medical education at Dundee University, UK, and I obtained that as well. So it was all just trying to improve and broaden my ability in teaching and learning. So scholarly teaching is reading and applying the existing knowledge on teaching and learning by attending workshops or reading the literature. There's so many journals out there now on scholarship of teaching and learning. So many online resources. So you can learn about, say, Bloom's taxonomy, or you can learn the best way to do a PBL, or all kinds of how do you incorporate AI into your teaching and learning. So we those are things we apply or explore, right? But we also do self-reflection after every teaching learning opportunity. We think, how did it go? Did it go well? Could I have done it better? What were the positive points? What are the negative points? And we try to sort of get our own self-reflection, plus we try to get peer evaluation of our teaching and learning and then try to sort of apply it. So we have this sort of virtuous cycle where every time we do a teaching learning activity, we reflect, we get evaluation, we might ask students how we fared, or you can see sometimes from the body language how you whether you made an impact, and then you try to improve your teaching learning. So that's scholarly teaching. But that's still not SoTL, right? So these are the things we do. We reflect on our teaching. We try new techniques that we hear about, snowballing or whatever the techniques. We discuss with others, how this didn't go well. How could I improve? We get peers to come and evaluate. That is now part of the QC system, quality assurance system of the university. There are mandatory peer evaluations. We may do student evaluations and feedback. We do curriculum review, and we meet up with our peers or within the departments. It's all part of trying to apply the literature or the knowledge or the current the methods or up-to-date methods of teaching and learning in our practice. So that's what I'm trying to show you. There's teaching, and then there's the subset of scholarly teaching where we use the current knowledge on learning and apply that to our work as academics and as teachers. Then, in that case, what is SoTL then? What is the scholarship of teaching and learning? Now, this is one step further where we not only learn through the literature and apply through the literature what is already known about scholarly teaching or student learning, but here we go one step further and we actually do scholarly inquiry into student learning. And we try to advance knowledge on teaching learning. So we advance the practice of teaching learning by doing research and sharing this research publicly. So we will not only just read and apply the existing knowledge, we will not only just self-reflect and evaluate our teaching and learning and then apply that reflection to our teaching, but we'll also go one step further and we'll do active research on teaching learning, and we'll share this research and the ideas of teaching and learning with the wider academic population through publications and presentations. So that's what SoTL is. It's just one step further. And if you look at that, let me go forward. So if you look at it in this Venn diagram, you can see there's teaching, there's scholarly teaching, and then the next level is where we come to the SoTL, or the scholarship of teaching and learning, where we are actually generating new knowledge or creating new knowledge in this area of teaching and learning. So while we're reflecting and doing peer evaluation and curriculum review, we also now start engaging in research in higher education. And really that sort of gels in very well with our other other aspect as academics, which is as academics as researchers. So academics are professionals, academics are teachers, and academics are researchers. So all this works very well in SoTL because SoTL helps us to combine our love of teaching and love of academia with our interest and love of research. So it's the interface between our vocation as teachers and learners with our vocation as professionals and as researchers into that area of our profession or the area of expertise that we have taken on. So this is the interface between our training as researchers and our training as academics. So SoTL then, like, or teaching as research, you could call it teaching as research. That's another, way of considering it, is, as you all know what research is, systematically investigating. And here you're systematically investigating how students learn within a specific educational context. So really there is no rocket science here. It's like any other research that you do. You pose a problem about an issue of teaching or learning. and then you study this problem through an appropriate method. So the method appropriate to the disciplinary epistemology. So in other words, we have to learn now a new set of study methodologies. But this study methodology, you already know the study methodology in relation to your own professional discipline, but now you have to learn the, the study methods or the methodology that you use for studies on teaching and learning. And then you you come up with results, and then you give recommendations, you communicate your results, and then hopefully these results are applied to the practice of teaching and learning. So that sort of cycle of research you are all familiar with. And when you apply them, of course, the new problems arise, and that's how research in any area goes forward. So again, no rocket science. How do you set about SoTL or teaching as research? So first you identify scholarly questions, and these can just pop up when you are teaching learning. There are so many queries, like when you sit at a PBL, now how could I do this PBL better? What is or you might say this is Generation Z and Gen Z, and they seem to have a completely different way of learning. Now, how do I adapt my teaching learning methodology to fit in with their learning methodology? So, or we might say, okay, this group has got removed from face-to-face learning because of long exposure to, say, online learning. How can we reignite that interest in learning face-to-face? So there could be so many questions that arise when you are engaging every day in your teaching and learning activities. So then what you do, obviously, you have to go back to the prior literature. To go back to the prior literature, you try to find out, obviously, broad base your understanding of that particular area, go delve deep, broad and deep. And then with that, you can start thinking about how you could investigate this particular problem. So you design your investigation using the standard methodologies. There may be standard questionnaires, or you might develop novel methodologies that you think will be useful to study the question. And then, of course, you recruit your participants, you collect your data, and then you analyze it, and then try to see if you can find in the data some kind of message, some kind of recommendation, some kind of finding that improves not only your own teaching practice, but by disseminating in your publications and presentations, you try to you try to disseminate the findings you have got, generalize the findings to others, try to stimulate others to confirm or refute your findings during doing similar research, and you end up building this collective SoTL knowledge. This collective SoTL knowledge, which is of great value to teachers who will then adapt their own teaching based on the contribution you had. Say all of us can add a little bit more to that, push the boundaries, add a little more to that knowledge that will help others, start at a better place when they start their journey as teachers. So this is just, the regular sort of diagram showing you how research is done. You know that, which you know already. You observe a teaching learning problem or an opportunity. So you document that. That's what we do in our reflection. That is why we as teachers or as human beings, reflection is such an important part of life. At the end of the day, or at the end at the end of any particular teaching learning activity, we should always reflect. And while we're doing it, we observe also. We observe ourselves, we reflect on ourselves, and we document what happened, and then we identify a problem or an opportunity. And then we consult the literature, and through the literature, we get idea of the interventions or the methodology we can use. Then we do the systematic, we recruit the participants, we do it in a systematic way. We document all the results of the observations, analyze them, and then we will try to publish it. And then when we send it for review, we get peer evaluation of our methodology and what we have done in our conclusions, and then we um, um, okay, sorry, we obtain peer evaluation, maybe others about our what we have sort of found, and try to add, maybe read some more, maybe submit our results to others, identify the issues that we have. Remember, in one particular study, we might find one or more different issues or findings. We synthesize them, prepare the manuscript, disseminate and publish it, add to the knowledge base, and then that becomes part of the literature, right? That then becomes part of the literature, and the whole cycle starts again. So SOTL is no different from um, any other discipline. The way that research is conducted, the way it pushes the barriers of knowledge is the same way. So we are very familiar with this whole process. So, of course, the methodologies are different. In methodologies, it's a lot of it is, though there's quantitative research, a lot of it is also qualitative. So, depending on our sort of speciality. Now, I think in medical research, we often do a lot of quantitative research, and we are a little bit distant and unfamiliar with qualitative research methodology. So, we might have to brush up or learn how to do qualitative research, but it doesn't have to be in quantitative or qualitative. It can be things like reflection. Just reflection is so useful. Reflections, analysis, writing articles, and opinion pieces. You get so much wonderful uh, insights by academics just on based on their own personal reflections. So that's why it's important to reflect, to keep journals. Journaling, it's called, where you actually document your reflections, and then after you've collected some reflections, you can analyze it, and that could be the basis for for your SOTL. But then you have other methodologies, interviews, focus group discussions. You can have questionnaires and surveys, which are then quantitative or with a qualitative component. You can combine the two, of course. You can do just things like desk reviews, like content analysis of text. You can critique existing texts. You can use existing data to analyze. There are quasi experiments that can be done at a higher level, almost like clinical trials, quasi experiments, observation results, research, and even case studies. So, all types of methodologies can be used in teaching learning um, uh, in SOTL, and really reading the journals would help you to see the wide variety of research methodologies that are available to use in higher education. So that may be something that we could learn through workshops or through online resources, or how to use the methodologies that are sort of suitable for SOTL. So why are we doing all this? Well, all of us want to improve our teaching effectiveness and the teaching learning effectiveness of the institutions we work at, and in general. That's just as much as we want to push forward the boundaries of our discipline, and say in health, making healthcare more accessible, more effective, more useful to people. Just like that, we'd like to make teaching and learning more accessible, more useful, more efficient. So that's one reason why we do SOTL. And we want to, why do we teach? We want to promote student learning. So we want to make sure that the student learns what we teach. We don't know how much of our teaching really results in student learning. And that's always been a sort of, what can I say, something we always worry about. We teach, but then how much does the student learn? So, so the emphasis, as you know, has shifted completely to away from teaching to student learning. So through our research, we may be able to promote student learning, which will be a huge impact to the student population, and transform the whole academic culture into one that with a focus on the student and the focus on doing things in a in a scientific manner, I would say, or scientific or a rational or a even business, if you can think to make it efficient and effective. For every effort that we put in, we should get a better result. So as these researchers say, academics apply to teaching the same standards of professional accountability that govern more traditional scholarship and reconfigure teaching from an amateur activity. Remember, we were all taught by amateurs, right? Lot of teachers came in, with they knew the subject, but they didn't learn how to teach. So it was an amateur activity, but that is no longer acceptable. We have to all, as teachers at every level, we have to transform this teaching from an amateur activity to something to an expert activity. So, so when you're doing this, is just I'll just close up with some of the questions that, say, a peer reviewer would ask if they're looking at, or someone who's say you apply for a grant or something to do this particular research. They will these are the questions they will ask as they look at your research proposal. It's no different from the way they evaluate a research proposal that you would submit for your own in your own field for any type of research. So is the basic purpose stated? Are the objectives realistic and achievable? Is it an important question in the field? Is it original, important? Is it applicable, feasible, realistic? And how did they know that their students were learning? And did the students' learning promise to last? These are the kind of questions that you are asking. Does your study try to answer these kind of questions, right? How do you know? How did you measure your students are learning? How do you know whether this would last? And also, do you have an understanding of the existing scholarship? Are you widely read in the subject? What is your literature review? Do you bring necessary skills to your work? And do you bring the resources, or the sort of the you might be trying some new methodology, some interventions. So do you have the resources to move this project forward? Is it also, if it's interventions, then are these interventions practically applicable in the long term? And are the methods appropriate to the goals? And do you apply the method correctly and modify the procedures in response to changing circumstances? And then did you achieve the goals? Did you recruit enough participants? Was the study conducted in such a manner that it achieved the goals? Does it add consequentially to the field? And does it also are there applicable results? And does it open areas for further exploration? So the same sort of questions that we ask when you're doing any type of research would be asked about your proposal and your study proposal for studying for SoTL as well. And then, of course, once you have done the research, then you will be presenting it either as a presentation or a publication. So again, suitable style, appropriate forums, and is the message presented with clarity and integrity. And then for the discussion part, people will say, do you critically evaluate your work? Do you bring breadth of evidence? And improve the quality of future work. So really, yes. So that was what very simply, I hope I managed to simplify what is meant by SoTL and make it more accessible to all of you, so that you could all of you can just launch your own journey in scholarly teaching and then SoTL. So thank you very much again for inviting me to this to deliver this lecture. Thank you.
Thank you, madam. Now I think Dr. Vindya is ready for her section.
Yeah. So thank you, Yasas, for introducing me as a speaker for the forum. But actually, I think I'm here to share my experience as one of your colleagues. So you all can relate to my experience and think of the ways that you can practice scholarly teaching and SoTL. And thank you, Enoka madam and Nelu madam, for asking me to share my experience with my colleagues. So I hope that you will learn something that is relatable to you regarding scholarly teaching and SoTL with my experiences. So, can you see the screen, Yasas?
Yes. Yes, we can.
Okay, so I'm going to talk about my academic journey towards scholarly teaching and SoTL. So when I think of how to talk about this, I thought if in different ways. Then finally I thought I will talk a little bit about my foundation for my scholarly teaching and SoTL, and what was my motivation towards it, and what is my drive for SoTL. So when I talk about the foundation, like you all, when I first became an academic or joined the university as a teacher, I had no clue what I'm supposed to do. I thought the teaching or the being a lecturer is just to deliver lectures. So in my first year, I worked at University of Perera, which I practically did the same, like delivering lectures and conducting practicals and all. Then as my next job, I joined the private medical faculty, and I met Professor Nelun De Silva, Nelu Madam, whom with I'm working even today. And looking at her and working with her, talking with her, I learned that being a lecturer or teaching is not just delivering lectures. It's something, as Enoka Madam said, it's a total different discipline that we have to master. So you have to have different set of basic knowledge. You have to develop different set of skills, as well as you have to have that mindset and the attitudes. Like in the KSAM model for any discipline, which we'll teach our students. So that is my introduction for the scholarly teaching, and then I started scholarly teaching with working with Nelu Madam and all. Then when it comes to SoTL, in fact, I learned SoTL like today with Enoka Madam. Enoka Madam became my PhD supervisor years after that, but this is the very first time I met Enoka Madam, just like a similar workshop, learning about SoTL. So there, now here you can see both my mentors, Nelu Madam and Enoka Madam, in a workshop conducting SoTL for, I think, at Slahi. So likewise, we had a workshop on SoTL, and me and my colleagues started beginning to think of SoTL. So without stopping there, we thought of why not we do a surveillance on how actually the academics in our institute and the clinicians in our institutes know about SoTL, and what do they do about SoTL. So we did a surveillance, we get their perceptions, and we did something like we gathered data on what they have done towards SoTL and all, and we wanted to share that. And we came up with this presentation at the conference on higher education Sri Lanka in 2017. So that is a little bit about my foundation. Then let me talk about my motivation for SoTL. Well, of course, I think my biggest motivation was the challenges that I have encountered. So just like me, for you all who works at Sabaragamuwa Medical Faculty, challenges are not a new thing. We all get challenges every day, face challenges every day, and challenges are surrounded by us, I think. So for me, I think my biggest challenges and the best opportunities that I found working in these newly established faculties. So in my academic career, I have worked in two newly established faculties. One is the private medical faculty SITEM, and then I joined the Faculty of Medicine Sabaragamuwa. Both are two different places, but having the similar type of challenges where we had to start from the scratch. I think one biggest advantage for us here, working in a new faculty, is everything you do here is new. Unlike in a well-established faculty. In a well-established faculty, before you, there must be so many people who has done the same thing before. You might find a new thing, like, a little bit of development and all, but here, whatever you do, it would become new. It would have a major impact for the future of the faculty, for the future of your career, as well as for the future of your students. So we are surrounded by the opportunities for SoTL, for our motivation. We just have to grab it. So just to show you some examples of the initial work towards SoTL of mine. Now, here you can see in the first publication or the presentation, we have, in my previous employment, we have introduced a elective program for the medical curriculum. And so we wanted to, now this is, I think we had a similar type of discussion very recently also when we introduced the elective program for our students as well here. So we were discussing about the drawbacks. We were discussing about the depth of the, the topics they were doing, and how can we improve those kind of things. But we just stopped at that, at the discussion level. But in the previous employment, what we did was we put it into, into a study. We gathered the information, we did a study, and we shared among the other academics where they can also, find something relatable. Well, if there is a drawbacks, what we think of our reflections, how they can mitigate it, likewise. So even if today, if we go and read it, when we are doing the electives for our students, we can go and see if there are similarities or dissimilarities, or whether, whether something we can adapt from that. So something like that. And then I know we all know this technique about the flipped classroom model. But during, like in 2015 and 16, it was like a very big thing for us, where the problem was that, less motivation of our students for the lecture, for the didactic lectures. I think the same, type of issue that we are facing day to day, and we talked among each other. So what we thought of, okay, we are going to reduce the lecture times. We are going to give them the, the materials that they can study at home. And then we are going to convert all the teaching learning hours to these, case discussions or interactive sessions. Then without stopping there, we collected, students' feedback, we collected the academic feedbacks, and we kind of like did a study on the student performance for the topics that has covered from the didactic lectures and the flipped classrooms. So, and then we presented that in international conferences, local conferences, and also we published a paper in Asia Pacific Scholar. And the last two, publications, you can see it's on online lectures. Well, although online lectures has become a hassle for us after, like post-COVID era, this is in early 2014s and 15s, where kind of like online teaching is a new thing for us. So we use this, just one thing is to motivate our students to have a different style of teaching. And then the other thing is, the last one, you can see, we use these online platforms as an online formative assessments. Again, I know Yazas and all, you are doing that these days, using our online platforms to have formative assessment. But at that time, it was a kind of like a new thing for us. So again, as Enoka madam said, we reflect on that and we wanted to share these things. And what we did was we, feed the answers to the system, so the students would get automatic feedback, and that would reduce our, like work time towards the formative assessment. So all these things we gathered, and these experiences we shared with the with other academics. So that is a little bit about the motivation. Then let me talk to you about the drive. So drive, I think, is my day-to-day practice and my reflections, which I think I have developed thanks to my mentors and with my experience. I've been practicing, scholarly teaching and SoTL for over 10 years of time now. So now one thing I have to tell is, if you wait until you find time, or if you wait until everything becomes perfect, you will not find any time to do anything. So you have to start where you are, you have to use what you have, and you have to do what you can. One good thing when it comes to, higher education research, the time, you are already having the time that you teach your students. So use that time, inquire the questions you have, and try to mitigate with some sort of novelty, and then share your experience with your colleagues like we do today. just to show you the continuation of my higher education research, this is one thing that Nelu Madam and I myself used to do even from the beginning, like even before Sabaragamuwa Medical Faculty, we did this self-correction approach for the unsuccessful students for their part 1 exam. So what we did was we got them to the department and we gave them their paper to go through with the marking sheet, and we asked them to correct themselves, correct their answers using the mark sheet. And after that we had a discussion whether they think our marking scheme is proper and whether they think their perceptions about their scoring and likewise. So which we found out that gave the students to much confidence in our marking, as well as they themselves realize where they have gone wrong. So we thought that it's a good thing that we can share this. So again, we had shared these findings in higher education conference in Sri Lanka. Then the last one is actually surprised me also. This is in late 2023, where the ChatGPT has launched and make a big fuss in academia and in all the other professions. So the talk at that time was that ChatGPT or any AI would replace the teachers very soon. So we wanted to see that, and we wanted whether the ChatGPT can be used for self-directed learning for microbiology. Now, mind you, this is at the very beginning where nobody knew what many in the academia knew what are the limitations or these hallucination or black box or these kind of things. We did not knew. So what we did was for our clinical cases, we feed for ChatGPT and we tried to find what ChatGPT would provide us as answers. And what we found was it was not curated for endemic diseases that is prevalent in Sri Lanka. Most of the cases like like infections like UTI and all, they gave very perfect answers, but not for like TB and scrub typhus or actinomycetoma, those kind of infections they could not capture. And there were like large discrepancies with the answers that they have provided. So we thought that this is quite interesting, so we should present this. So luckily at that time, for the very first time, Asia Pacific Medical Education Conference, which was usually held at other countries, I think for the very first time they had it in Colombo together with, which is conducted by National University of Singapore, and this time together with Medical Faculty Colombo. So we went and present this. However, to our surprise, we won the best presentation award at the Medical Education Conference. So what I want to say is, so these are just very small things we thought of. We did not think that it would impact that much. But of course, when you share your knowledge, there are paths opening that you don't even think of. So after that, I got invited for several international, forums to share my higher education experiences, both local and international. And then, in fact, I got an invitation to contribute for a chapter in this book called Scholarship of Teaching and Learning, or SoTL, in Asian Higher Education, just last year. So I thought, why not? And it was published this year. My chapter is called as a SoTL journey in Sri Lankan higher education and my academic journey towards SoTL. So all that I said now, together with the examples, much more examples, and all these things, they are in the chapter with my research work also. So what I wanted to say is, if I can do that, you all can do it, because you all have that mentorship here. We all have our senior consultants who always guide us. And we all have all these enormous opportunity and these challenges that we face every day. And we just have to have our motivation to use the time that we have and do better job being teachers and do scholarly teaching and make our way towards SoTL. Thank you.
Thank you very much, Dr. Vindya, for sharing your experiences, and it was really interesting. Thank you very much, madam. And we now open the floor for any questions if you have any. Have like 12 minutes till 1. I have a small question, madam. When conducting SoTL research, especially involving like our students, what about the ethical aspects? Like, because I find sometimes the ethical aspects are quite challenging, because sometimes the students can be considered as a vulnerable group when we use our students for the research. So how do we tackle that problem? Do you get that problem with your involvement research as well, madam?
Yes, that's a very good question, because it's like any power group. When you have some kind of sort of power over another group whom you're trying to study, even doctors and patients, or even there is a power relationship, and definitely that brings in ethics issues, especially in terms of consent. So, and with SoTL or education and research, just as much as other research, you do have to get ethics approval for your study. And in the ethics approval, that is one of the major areas that are looked at by the ethics review committee. How do you mitigate, or how do you handle or manage this power relationship? So in most of the cases, for example, when you obtain informed consent, if as a doctor patient, also we don't usually, the doctors don't the doctors treating that patient are not the people who obtain the informed consent, right? You have a RA or a nurse or someone who's recruited for that purpose to go and consent your patients. That is what is considered informed and voluntary consent in research in hospitals. And similarly with research with students, you're not supposed to directly, or the person who is sort of examining, especially if you're an examiner, the person who determines whether the student passes or fails, that kind of person is not the person who should be recruiting students for a research. So there are other ways to do it. You have RAs who go and recruit students. You can have just by advertisement. It could be completely like an anonymized questionnaire type of thing, where they're collected without, they're replying to the questionnaire, or which could be online, or distributed, the fact that you fill it in and drop it off, which could in some anonymized box, that could be considered as implied consent. So there are different ways that you obtain consent, but definitely the sort of the power relationship between the teacher and the learner is a very important consideration for ethics review committees when they are granting, that informed consent process is studied and looked at it in great detail by the ethics review committees. Yes.
Thank you, madam. That helps.
Can I make some comments?
Yes.
Yes, sir.
Yes.
Thank you, Enoka and Vindya, for the excellent presentations and sharing your experiences. Now, there are a few things which I agree with you, and which we have to implement in a newly developed or established faculty. One of the things is that there is not much of a, other than this lunchtime talk, there are no forum, or there is no platform to share the medical education research or the new things which are happening in the educational world. So that is one thing which we have to develop. There should be the lunchtime talk is it may not be limited to medical education. It may be limited to certain other things, or open to other things. So there should be some sort of a forum, like a journal club on medical education or whatever it is that medical education unit can look into that. So that is one thing. And also the sharing of your work with the entire academic staff. So we are using that WhatsApp group now. Occasionally, I can see some of the shared research papers which you are sharing in the WhatsApp group. So that is one aspect that you have to think of. The second thing is about the related to what Yasas asked and what Prof. Enoka tried to answer. Now, one of the things when you are doing medical education research is that this control group, if you are doing an interventional study on introducing some newer concept in, say, delivery. So, for example, what Vindya has done, the flipped classroom. So, if you want to see whether the flipped classroom is effective in relation to traditional lecture, so you have to have a control. So, how we are going to have a control? So, it has to be the same batch, because if you are trying to compare two batches, they are not comparable. So, if you are using the same batch, randomly you select the students and you implement or you expose that selected groups, the research group to the intervention, and the control group to the normal traditional way. And then you get the data. And one of the ethical issues is that now all these both groups are sitting for the exam together. In future, there is suppose secondary B students, they have to sit for the secondary B student. So the important thing is that you have to be careful not to sort of that interventional method should not be additional how do you say additional method of getting knowledge for that interventional group. So in other words, if you do intervention, and then you have a control group, and after your study, the control group also should be exposed to the intervention. So that is one thing. I think, Yasas, that is what you asked. You are trying to ask, sort of if you're having these interventional things, that how the control group is not getting the benefit of the intervention. So after you do the study, you have to expose those student control group also to the intervention. So by that, sort of this ethical problems can be avoided. Then the third thing which I want to focus is on getting data. Now, I had this problem when I was started this medical education research way back in 1995, 96 in Colombo, as well as when I went to IMU. Especially getting data related to assessments, the student scores, the marks, because the authorities, they say that they are confidential. They are confidential. So now if you want to, sort of do some research on the assessment. So for example, say now I had this problem when I was writing a paper on whether the continuous assessments predicts the performance of the summative assessment. So what I had to do is actually I myself and Enoka must be knowing Dr. Mangala in the physiology. So in the BSS, when we were trying to do this, there was a big problem to get these marks, because they say that they are confidential. They are confidential and they can't release. But when I went to some other country, sort of I learned that, sort of even though the marks are confidential, if those marks can be issued without the names of the students, then it will become not confidential. So there are ways of implementing that, sort of even to get the marks. So I don't know. So these are the policies that we have to develop in the faculty. So the Sabaragamuwa faculty should have a policy approved by the faculty board and the Senate that the scores or the marks of the students should be available for medical education research as far as the confidentiality is preserved. So that is one other thing. Really, there is, I don't know, Enoka, whether it is, and Vindya also can contribute, give a feedback on this, what I'm going to say. Now there is, now suppose I am in the Department of Anatomy, and my research has to be based on anatomy, and my publication has to be based on anatomy, the pure anatomy, not teaching or learning of anatomy for my promotions. Because this happened to some other people in Colombo as well as in some other universities. Their articles or their publications were not considered as what you call, for their promotions. So that will, that will not give a motivation to the people who are doing research in medical education, because they are purely doing the research which are related to their subject, their discipline. Even though that you are now, for example, now Vindya has done so much of work on teaching and learning of microbiology. Now you have to be sure that these are accepted for your promotion. If the promotion is based on sort of some comparing some cultures or some antibiotic sensitivity or whatever it is, and if these things are not considered at the same level, the faculty will not do research on educational aspect of a discipline, but rather they will go and do the pure laboratory research. And so those are the things which are and the other final thing is that even we had a research symposium Monday at Moratua. We were discussing some of these things, and one of the things is that you do research in an institution, say Sabaragamuwa or some other university or Colombo, but if you are not implementing it in that institution, the sharing of that with the whole world is useless. And that is my personal view. If you are doing a research in an institution, you are obliged to implement it for the benefit of the students of that institution. You can share with the whole world, but you have to implement it to the students so that the students will be benefiting from your whatever you have done. So those are some of the comments. Sorry, I have taken your time. So once again, thank you, Enoka and Vindya.
Thank you, sir. Thank you, sir. Do you have anything, madam, to add?
Yes, sir. Can I share something?
Of course,
Hello?
yes. Yes, of course, madam.
Yes, sir.
Can you hear
Can
me,
you
madam?
hear me? Yeah, I just want to say to what Joe said, I think there is equal weightage given to education research as well as discipline-based research. I think this was talked about at the UGC, and I think Professor Ekaratna is spearheading SLAHI and higher education in Colombo University. They gave, there is equal weightage, and I don't think they penalize you or take away marks for education research.
Right.
But sometimes it depends on your interview board, Vindya, Delun. Because I know that some people have been even sort of sarcastic asked, now, do you think that this is research? That is that the people who do not grasp the fact that educational research is also has the same weightage of the laboratory, clinical, and community-based and social research and research on humanities. They will look at it so it depends on your interview panel sometimes, and also the people who are marking. So it is good that if the UGC has taken an umbrella decision on this.
Vindya or Madam, do you have anything to add in with regard to that confidentiality issue, like for the assessments that Joseph
I think the
raised?
point that Professor Joe Perera made is very, very valid and important. I really don't know what the UGC stand on it is, but I think that it's good if it is made expressly noted by the UGC that that research will carry equal value. I think that is not very clear. I think Professor Joe is quite right in that. Yes.
There are no other questions. I think we can.
One other thing,
Yes.
Yasas, is sort of these ethical committees. Now, this is
Yes.
another problem. Sometimes ethical committees, the members of the ethical committees are the people who are doing research on laboratory and clinical and those things. So in an ethical committee, there should be somebody who has done on research on ethics, research on medical education, so that when these research proposals is submitted to the ethical committee, so there should be someone who can understand the concepts of this ethical, this educational research, and convince the others about the positive aspect of this research. So that is one thing that, sort of all this research. I don't know, Enoka, now, do you have in Colombo, in the ethical committee, do you have any representatives from the medical education unit or the educational research?
I'm not sure, sir, because I am not on that ERC anymore. But if we
Yeah.
need an expert, we will always send. Anyway, we do review quite a bit of research on education, so it's quite encouraged. But
Yes,
whether,
that's good.
for promotion, whether these are considered equally valid, sir, that I don't know.
Yeah.
Right. Thank you very much, sir. And thank you once again to Professor Enoka Corea and Dr. Vindya Perera for their insightful contributions, and to all of our participants for their active participation as usual. And we'll have another session in 2 months' time, and we can conclude today's session. Thank you very much again. Have a nice day.
Thank you.
Thank you.